In our practice, if we remove a patient's tooth and are doing a ceramic implant replacement for them, the procedure goes something like this. Local anesthesia or sedation, depending on the case. Our goal is to not only have the best long-term health outcome for the patient, but also to keep them as comfortable as possible during the process. So when I start the surgery, I start with those two intentions, and I make sure that the patient understands every decision I make during the surgery is going to be for your long-term health outcome. The other part is my goal to keep you comfortable throughout the process. After anesthesia, patient's comfortably numb. We then remove the tooth. We do so in the most atraumatic or least traumatic way. A lot of people joke about there's no atraumatic way to take out teeth, but we do so very carefully, very precisely, so that the surrounding tissues are preserved. When the tooth's removed, the most important thing is that we have good gum and good bone tissue remaining. We then clean out any infected tissue, both mechanically and also chemically. So we utilize scrapers of various kinds, very aggressive drill bits that help remove both the periodontal ligament and any infected tissue. And then we thoroughly irrigate the site with ozonated water and then also with ozone gas. During the initial portion of the surgery, the patient's blood is drawn. We use a centrifuge to create what is called platelet-rich fibrin. That is a blood concentrate that is full of growth factors and cells that help regenerate a patient's tissue. So whether we're just doing a bone graft, meaning trying to help the patient regrow their own bone, or we're doing implant placement, both ozone and platelet-rich fibrin are a big part of that. If we're going to be placing an implant, that implant is verified by the Clean Implant Foundation to be not only sterile, but clean as analyzed under scanning electron microscopy. Our implants are clean. Many of the large implant companies don't subscribe to, participate, or get their facilities certified by the Clean Implant Foundation because of the cost and because really it's a whole lot of work to make sure that the implants are not only sterile, but they're clean under electron microscopy. So those implants are then removed from a sterile package. The patient's implant site has been prepared either with robotics or with dynamic navigation, and occasionally even with freehand methodology. Platelet-rich fibrin is placed into the osteotomy and the implant is inserted. The surrounding area, if there are gaps, is filled with either synthetic material or an allograft, which is sterilized human tissue from a tissue bank, and platelet-rich fibrin. Sutures are used to close the site if necessary, and the patient's allowed to heal for initially 2 weeks before being seen again, 6 weeks for kind of a final surgical follow-up, and then at 5 months is when implants in our practice are typically restored. Restored means we put the teeth on them. And in a lot of cases, patients can have temporary teeth during this entire healing process so they can smile, they can look nice, and don't have to go with gaps in their smile. This process has been refined. It's been refined by my mentors. It's standing on the shoulders of all these years of successful titanium implant surgery. And like the rest of the dentistry that we do here, these surgeries are so clean. The restorative portion of it, where we're attaching teeth and finishing smiles, it is so clean. Patients can feel it and see it. And we, as a surgical and dental team, absolutely see it. We really enjoy giving this kind of service to our patients.